So thank you for coming. Thank you for those joining us online. We will start as planned for about 30 minutes with me going through some new, some old stuff within Health One, and then we will go ahead and hand over to Philip. I'll probably take about 30 minutes, and then there's coffee outside with pastries waiting for you while we are changing the computers. So those are things that we were doing this year, right? So we met in Sligo first. We're here now, Limerick next weekend, our annual scientific meeting to kind of mark the date in your calendar. That will be 7th of November. And for today, we'll look at few new things that were developed and from Leap or through kind of user group, and few all things reminders. I'll want to show you two things about IT in terms of not getting people into your systems, and then we'll hand over to Philip for a complete GP presentation. Again. So in terms of new stuff, primary childhood vaccinations, as we know, that's the new schedule 2024 now ready for all. The most important thing to not make it broken is to put it in basic medical transaction. There were practices who put it elsewhere, and this is where problems often started, and there's issues with recalling. If you have it elsewhere, give a buzz to support, they'll be able to sort it out for you, but as a habit, it always should be in basic medical transaction. And then when you create the schedule, it will assume that date of birth is the date where we start the timer, and you'll have in your vaccination tab, you'll have all the vaccines you want to submit, and you click on the job. It will auto-populate all the patient's data when it's there in the file. That's a dummy patient, so they don't have it. You click submit, similarly to your flu, to your COVID vaccines, and job is done. You have your dashboard like for other online recorded vaccinations. So you go to analysis, you go to e-vaccines, and from here you have to select the childhood vaccinations, and you will have your dashboard ready.
Sorry, we missed the start. Could you go back?
No, I can't. No. You again. Now, those errors that you can see on the side here, error 400, that's not a true error, okay? That had been submitted. It only comes like that because there's different crowd paying you, right? So error 400 means that you'll be paid old way rather than through your PCRS. When you get your acknowledgement claim number, that means that, yes, that's the new way, so it'll be all transferred through PCRS to you. Now, we do have now an email reminder about appointment, unless we want to go back here. Any questions? No, I guess we are all doing it, right? So the important things is keep it a basic mail transaction, the schedule. Don't be worried about error 400. It's not an error. It's just the way they had to tell us that it's still going to be paid the old way. Only one.
The children are late. You can't do it that way, and they're not the old way now. So there's there, like if they're going to be.
They're late as very, very late. Or how late are they?
This way, and you can't. There's provisions this way. So.
You think they're older than 2 now?
Yeah.
I don't know.
You print them off and just send them in.
Can you? Yeah. Are they? Okay, I'll check with lads and see what's provided for that. Thank you. I can count on you. Yeah. Email reminders. So that was requested by users. It's there now. So to set it up, you go to your tools options, and within messaging, so tools options messaging, and you have the email appointment below your scheduling text. By default, it's 24 hours before appointment. And to edit the template, you go to tools, and then it's funny because it's an SMS configuration table templates. But you just look for appointment email, And you can put your stuff here, you can change your fonts, you can change how it looks like, and that's your template for emails. Now, bear in mind that if you're using appointments also as way to put a message to a doctor or to put tasks to a doctor, you have to exclude certain situations from it, because otherwise the patient will be freaked out. They'll get reminder, but it wasn't truly an appointment, it was more a reminder, right? So we'll skip that and I'll go back to this. So what you want to do is you want to exclude it. So you go to the configuration of appointments and you have your SMS exclusion here. So it can be either the type of the appointment that you select from your list, right? So whatever you take here in SMS exclusion, so let's say if it's telephone consultation and you don't want them to get an email reminder, they won't, right? Because then you don't put doctor under pressure that they have to call at 4:05. And same if you have another thing here that's like admin or prescription, that would be excluded, right? The other way you can exclude it is using rooms. So if you have a room called tasks, right? So you can have on your schedule your users, your doctors, nurses. You can create a room if there is a room sharing, or you have a separate clinic, or some people, as I'm aware, are doing that for prescription, for jobs, for tasks. So you can exclude entire room here, right? Do not send SMS for this room. So if you're using this column just for reminders, workflows, anything you put there, that will not trigger your automated email.
Correct. If you make the appointment on the day, so within the 24-hour window.
They won't. Yeah, it has to be 24 hours, yeah. And what I skipped here, because my layout here was stupid, is we also have the use of preferred name, right? So when you do your templates, you can insert different fields. And before you had first name, last name, but we all have patients who are known as Grzegorz, but they're known as Greg, right? So you can use the preferred name option now. If it exists, it will be used. If it doesn't exist, it will fall back to the first name. So here we have the preferred name. If our template looks like that, then your preferred name, Health One will look for this item in the admin, right? If this item preferred name exists, that will be used. You can also put it to your top title of Health One. So when you open patient's file, you can also see it. So you know how to call them into the room if they have different preferred name to their actual first name. And that's where you can set it up, right? So again, you go to tools, options, and you have straight away in general, items in patient's line title, you can define them here. This is how it looks for us, right? So we see their last name, their first name, then in inverted commas, preferred name, date of birth, sex, age, if they're dead, date of their death, what's their GMS status, what's their category. If they're private, if they're GMS, which helps you with your billing, you just look at the opened patient's file and you know, do you need to give them a bill or not? You have all the items here that you have on the left, you can add there. So that whatever is within this item field, and essentially that's anything from their admin transaction you can put in. So whatever works for you, whatever you like there, if you like to have their email address, you can put their email address, you can use whatever you want. Yeah, if you double click, it'll go to the right. If you double click it again, it'll go to the left. Yeah. So those are examples, right? So if your preferred name is there, it'll be Dear Jane. If it isn't there, it will revert back to Mary. And that's without you changing the template. That's the template using preferred name, right?
Okay. The preferred name, is it on the admin section somewhere?
Yeah.
Is it?
You just start typing. Like if you add any item, if you want to add it, I don't think it creates there on a default. So if you create new patient, it won't be there. But if you just start typing pre-space NA, you will see all the items that fit those the description, and you'll find preferred name there.
If fail-safe that if for whatever reason text doesn't go, and then the alert be settled, because you know that you have your message queue and you suddenly go back and it didn't go, and oh my god, like it doesn't.
Yeah, so there was There was a lot of issues with texting. It was partially between some practices didn't register with Comreg, and that was causing problems because it was going to spam. Some issues were related to patient behavior on their phones, meaning they once said something as a spam and remembered that and it went to the spam. And third, there was a true issue with the people sending those texts, which they said they have resolved at the beginning of the year. And there was also a problem where Health One was kind of being a bit overwhelmed in those mass texting campaigns like flu and COVID, when they were gazillions of texts at one go. But since that had been changed to a way that it's spaced over time, so even if you set a lot of text at one go, in the background, it will take a batch of it, send it, give it a pause, send a batch, and again like that. So those are all the so those are all the issues that kind of we identified as probable causes, and they had been addressed. So there shouldn't be
And
really
you know, now with this
a
new
problem.
glitch that you can't, you have to go in. They won't let you send me SMS.
Yeah, so actually, it will let you send. You have just to
Oh, no.
select template and delete it. That was unintentional consequence of introducing the email reminder. So while this feature was introduced, something else had broken, but it's fixed now. So I'm on the version, I think 3.3.3.7, and that's fixed there. So that will come to you soon. Yeah. We went through that. This is my poor lineup of the slides, so sorry. We'll just skip those. And then non-send prescriptions. That was actually quite cool way to.
One scenario about the email.
Yeah.
If there is no email,
Well, it won't be sent. Like.
it will be sent as an SMS then, because that's what happened when I activated it, and there was no email in the file. They actually received SMS from the SNX.
Okay. That's good then.
So even if my SMS was not activated, they didn't have email in the file. They got, it was on the appointment. They got an SMS rather than an email.
Okay. So number one, thank you, because I didn't know. Number two, I think it's good. It's good fail safe. Yeah, because you assume they will get it. So yeah, good. The non-send prescription, again, that shows you the kind of strength of having quite granular data and items that you can go through and analyze. That was a question on one of the people on the user group. Well, how can we identify prescriptions that were requested from the doctors, but they were not sent? So you can do analysis that will find it. So what's the logic behind it? That the item drug prescription exists, but email prescription is not, right? Depending on your workflow then in the practice, obviously, our workflow would be quite similar to the practice who was asking for it, meaning that if that's a repeat prescription, somebody from the admin team would prepare that, send a message to a doctor, there's a script, repeat script to be made, you go in, look at the prescription, you decide, are you clinically satisfied it's appropriate, do you want to send it? If you're happy, you send it. But if you get distracted, if you open the message and then you get a phone call or you do something else, you forget, still the drug prescription item exists because the prescription had been pre-prepared by somebody else, but the email prescription is not, because that item only appears when you actually send the prescription out to the chemist, right? And that's your log, that's your proof that it had been sent, to whom it was sent, from which address and what time. Now, because of that, obviously the false positives will be if you have a letter from consultant about private patient and you want to have it up to date and you want to have accurate file, and you will add that now they're on this aspirin, but you actually haven't sent it because they have private prescription, that will come up as well. So that's a false positive. Another one will be typically, in our practice at least, for Mounjaro, right? When they say, no, don't send to my chemist, they're way too dear, I will go up north. And then you will print it all the way on the paper. So therefore you have then send it. So it'll come up as a not sent prescription, because yeah, it's true, it wasn't sent, right? True, yeah, good, yeah, because that also creates an item. But I would argue though that if you stop medication, I would encourage you to send it to the chemist. You want them to be aware that you stopped it, because sometimes, 3 months forward, you get an email, oh yeah, would you send this prescription for Johnny because we kept dispensing it, but we never got prescription. Like, what the hell? Like, it was supposed to be stopped. Is it not on by default now? I thought it's on by default. Is it not? Yeah, those optional prescriptions, yeah, but I thought that should be as a default when you create a new user. No. Okay, we'll have to make it as a default then.
And with the update, it's not necessarily have one update, but like even Microsoft, your system can grow.
Oh, really?
Yeah, that happens.
Interesting. Okay. I don't know. I haven't experienced that. I have it turned on since inception of the feature, and that stayed on. So, so that's Windows problem then in a way.
Yeah,
And where do you store your config? On machine or on server? Okay. Sorry. Okay, I'll shut up now. I'll carry on. Okay. But yeah, but I would still encourage you to send it because that prevents all the phone calls. Then, oh, did you forget it, or should they be on it? It just very clear communication. Your intention with the clients that yes, it was supposed to be stopped. There's new website in the making. It's on new hiug.ie, and we are trying to put the different mediforms and templates there. Those kind of commonly used and linked to the YouTube tutorials. So if you have your favorite mediforms templates that you like and you would like them to be shared with others, if you just send an email to me directly or to the user group, and we can update the resource database there. Now, screen to text, that was kind of created with help of different AI tools, really, and it's using open source software locally on your machine. And the reason why I made it is because what drove me nuts are those PDF emails from Matter Private, right? When you try to select the text, you copy it, and you get gibberish pasting it in. So I was in touch with them, and they said, oh yeah, it's kind of security feature in a way, but we appreciate it causes trouble, so we'll change it. I think that was last year. So they're waiting for the IT vendor to update certain things for them to be able to update it. So it's still the same since. So let's say you have a PDF, or sometimes even different way clinics do it. Sometimes you get letters that are PDF, but really image, meaning that the workflow of the consultant's practice is they print their letter, they bring it to the secretary scans it, and this beautifully letter that could have been small and tiny and selectable, it's made a picture in PDF, and that's what you have to deal with. So if that's the case, with this app, when you activate it, it will make the screen a bit gray, and you can select whatever part of the screen you want to be OCR'd. And when it's done, you'll get notification in the right bottom corner of your Windows screen that that's done. And that's then in your, as a text in your clipboard automatically. Huh? Yes, but better, because with the snip, what you will do is you will have a picture. So you'll be able to select a picture, and it copies a picture with that tool, and you can download it from the HIG website, right? In the off-topic thing, because it's not technically Health One really, but you can still get it. So what it does in the background is it takes the screenshot. It uses locally on the machine open source software to transcribe it to text, and then automatically puts it to your clipboard. So then you just select it. You can create an item called report, Control V into it, and you have beautiful searchable thing in your patient file there.
Can you use that as patient?
We can use it for anything because it's not Health One feature really. So that's outside. So it's explained on the website, but the workflow you can, or how you can link it to have it easy accessible is it's essentially a Python script, right? It's a Python code that you can trigger. And you can put the shortcut to that into a hotkey of your keyboard of your own preference. So I have Control Print Screen. So just print screen triggers the Windows snipping tool. Control Print Screen triggers that. So then I can select, and I have it as a text. But again, you can.
Gynecology referrals, it doesn't allow you to say put in an ultrasound. Could you do that if you're in the middle of doing like a health link referral gynecology and do a snip if you have an ultrasound result that you want to include into that electronically to send it through the health link?
That depends where you want to put it, because if you want to put it into HealthLink where you have dedicated field for the radiology, it will only allow you to pull data from an item existing in the database. You click add and you have to select an item. But if you want to put it in something else that allows you free text, like objective findings, like a comment down below, then you could, yes,
Okay.
presuming that you had opened this ultrasound outside of Health One.
Okay.
Because as you know, when you open HealthLink referral, it comes to the top of Health One. It won't allow you to go back to Health One.
So I could have it on
But
let's say PDF maybe.
correct. But if you have it opened outside, you can change the app, select it. Yeah, you can use it that way, absolutely.
I know there are a lot of people, staff are listening on the Zoom as well. So for them, is it, so they are doing it, so from workflow point of view, so it's saved as what is RTF file into the Health One when they're scanning it. Then when the doctor is opening and reading it, then they are using it, or admin doing this?
That depends on your workflow. So if you saved it already, if it's already OCR'd, if it was put through some OCR and it's RTF, meaning it's a text essentially, then it's fine, then it's a text, right? So the use of that is for anything that is not a text and you don't want to be printing in a way. If it's a PDF that's not selectable, is it an image that came through email? But again, that depends on your workflow. Because if your workflow is, we print everything and give it to the doctors who highlight, and then we scan it again and we OCR, then that's useless for you because you have different workflow. If your workflow is that we give paper to doctors only when it came in paper, and otherwise we just put it to a transaction and send message to the doctor, then it might help your clinician to decide, actually, that bit, I think it might be good to have it in a searchable way. And then you use that tool to put in an item report or comment or whatever is your, again, workflow preference, and you put it in.
It doesn't have to be PDF, it work on an image.
Anything that's opened on, so it doesn't matter what you opened. It looks at your screen. It makes a partial snapshot of your screen.
And you can select, it's not the whole print.
Yeah, you can select. Yeah. Like here, like you see, I had that opened. I finished at Northeast Dock, so that was selected, right? So you can absolutely select what you want. Now, the only limitation is it has to be rectangle, so you can't paint a circle around it, right? So it has to be rectangle. Grant, all then still good features. DXM filtering. So if you happen to look after few doctors' results or few different things here, you can create your own view, right? So you see, I have a view called Greg, and it automatically had filtered only results that have my funny Polish PSZ next to each other, because nobody else in Aaron potentially could have those letters next to them. I can use the semicolon as an OR operator, meaning if I wanted to look at my results and Pramod's results, right, I can put PSZ space semicolon space Pramod, and I would see his results as well. So if you want to see too, so especially for big practices, right, when you have a bit of buddy system that you look after each other's, but there is gazillion of clinicians and you don't want to scroll through all of them, that's how you can set it up for yourself. And where you go to do it, over here, you can save current view, right, as your kind of default, as the view you want to be using. You can edit it as well. So again, as this icon, this book that you go to edit current view. You can give it different name, and you can give it different settings as well, meaning, is it just waiting results you want to see? Is it all results? Is it errors that you want to see? And all of them are only viewed, only validated, only printed. So if you're looking, let's say, to create a view to chase all the printed results, assumption being that printed means that it's not our patient, so we printed this result to send it out to whoever sent it to us to tell them it's not our patient. That's what you can do. You can say, okay, just show me all the processed but only printed, and let's look at those. again, the ways to use it, whatever you find fit. But this is, again, the power of configuration, that you can select what you like and use it that way. Highlighting content of item in red. So sometimes, especially with those very long letters from Beaumont, when you get through HealthLink, when there is, again, you have to scroll through it to read it, plenty of noise, plenty of irrelevant information, and one line is really the meat of it, but it's so difficult to see it. So when you go to any item and double click on it and severity index, you change it to anything else but 0. If it's anything else but 0, what will happen? It then will be shown in red, right? So then you open this report and it jumps at you. You can see already, okay, this is the important, this is the diagnosis, this is the plan, this is the conclusion, this is what we have to be aware of.
I assume you could then do an action plan on that if there was something with it, you know.
You can do it with any item you want. So any item, when you double click, you will have this severity index. Is it coming through HealthLink? Is it transaction that you have created? Is it your own uncertainty? Is it that, I don't know, patient didn't behave the way that we appreciate and we want to flag it for other colleagues in this consultation? Or there's some unmet need or that you want to flag within the consultation, yeah. Another, because like I talk about it because I countered it, right? This problem. It's like, oh, what do I do here? So what about pneumococcal vaccines? And I think we had patients after some radio campaign that were coming for vaccines, like, oh, I'm 65. And we're like, okay, right, but it won't allow you to submit because you don't have GMS. So you essentially untick claim for this shot, meaning that you can still record it the correct way, but it doesn't submit it out. For those patients, we are allowed to use the cold chain supply of vaccines, but we still can charge for administration, right? So yeah, if they're eligible for pneumococcal vaccine, but they don't have GMS, right? So that's what we would be doing. You just untick claim for this shot.
Is the notification got PCRS?
Well, no, because you're not claiming. You're not claiming. Because PCRS notification is really for a purpose of you being paid for what you had provided, right? So if they're GMS, you would be paid for the service you provided for the vaccination. If they're private patients but eligible for the cold chain vaccine, you can use this vaccine, but whatever is your fee, administration kind of charge, go ahead and charge it. Small touch on security. I loved this suspicious brain, right? On user group email, right? I got a call from Health One support wanting to log in and fix a button in childhood vaccine, and they didn't let them in, which is what you're supposed to do, right? Because that's essentially what's called social engineering attack. Somebody calls you, they're telling you, oh yeah, we're from support, we want to fix ABC, but how do you know that this is who they say they are? So this person did the right thing. They said, yeah, thank you. And the email group, like, is that a thing? Is that happening or is it not? If they call you and you think it might be genuine, like, Fan William number is public, right? So you just call them back. You take their name, you call them back, and that's the safe way to do it. So I really love this message because that's good awareness about, and social engineering attack really, it's what typically gets people in trouble. We sadly give access to our stuff to the bad guys ourselves. The other thing that sadly is getting very, very popular is this click fix attack. So we all know, like, prove you're not a robot, right? Click here, click there, select all the motorbikes on the screen. So people are getting advantaged through that with something like this, right? You get instructions like, you might feel, yeah, well, we're getting those instructions all the time. Now, the key here is that they essentially want you to run something in the command line. And what you can see is something that looks quite benign, right? The problem is that you don't see entire message. So in purpose, it has so many characters going forward, because what's before is instruction to download something that will take control of your system. So if ever you see combination like that on a website that pretends to be verifying you, you know to leave it, right? Until you hit OK, until you execute this command, you're fine. If you just see that, you're fine. But if they want you to do Windows button R and paste something into it, that's already a red flag. You're not going there. You just leave the page, and that's it. Okay. Any questions about this? Are we very keen to see complete GP?
Yeah.
Yeah, that's what I thought. Yeah. Okay. So look, so there is outside, there is coffee, there are some pastries. So I'd encourage you to grab one. And in the meantime, we'll just change the computers and we'll carry on. Okay.